So,
So 1 minute,
uh,
we can start, please. I will set the time. Yeah.
Hello, good evening.
Hello, good evening.
I am Dr. Bukhari, and I am one of the doctors in the clinic today.
Yes,
You
doctor.
must be Mr. George, 40 years of age.
Yeah, I'm George, 40-year-old me.
Nice to meet you, Mr. George.
Thank you, doctor. Thank you.
Well, Mr. George, today we are here to discuss something about your current health condition and our future management plan about that. Is it okay with you?
Yeah, it's okay, doctor, please.
So, I have come to know from your notes that you have some shortness of breath. Is it so?
Yeah, doctor. Yes, yes. I have shortness of breath. I cannot take a breath well.
Well, I'm sorry to know this, Mr. George, but we are here to help you out today.
Thank you, doctor.
So, may I know since how long you have this problem?
Doctor, actually, it started about 2 months before or more.
And how it started, suddenly or gradually?
Doctor, well, it increased gradually. First of all, only it come when I'm running or climbing stair, but later on it become also when I'm do any effort.
And it is continuous or it comes and goes? I
No,
mean,
it comes on and go, doctor. It come only with effort, severe effort or like this.
right. And do you think it is getting worse day by day?
Yeah, yeah. It worse. It make worse. Yes.
And exertion makes it worse.
Yeah.
Anything that makes it better?
Actually, doctor, when I'm take rest, I said I feel it's better. Yeah.
And right. And Mr. George, how can you walk now without exertion?
Doctor, actually, when started, I have difficulties when climbing stairs or running. But nowadays, also when I'm walking for a few meters, I feel this shortness of breath. I should take rest.
And how much were you able to walk before this problem?
Before I was okay, doctor. I was running, I was doing everything, but since 2, 3 months, I feel that this is a restriction of my breath.
And do you have any cough, Mr. George?
No cough, doctor.
And right. And do you feel any chest pain?
Actually, no chest pain, doctor.
Any pain when you take a deep breath in?
No,
And do you have any whistling sound in your chest while breathing?
no.
Right. And do you have any swelling around your ankles?
Yes, doctor. I feel also my ankles become swelling nowadays. Yes.
Since how long you have feeling this?
Actually, doctor, I feel it since about 4 weeks. I feel my legs become more large.
Both of the legs?
Yeah, both. Yes, doctor.
Till which level? I mean, can you tell me at the level of the knees or above
Two mid legs.
or below?
Yeah,
Middle legs.
yeah, mid legs.
Any problem in putting your shoes?
Yeah. Yes, doctor. I
Hmm.
have difficulties now to wear my usual shoes.
And any swelling anywhere else? Like anywhere else?
Well, like what, doctor? No. Only I feel
No
this
swelling.
swelling in my legs. Yes.
And do you feel any difficulty in breathing while lying down flat?
Yeah, really, doctor. Also, when I'm lying flat, I cannot. I should sit directly.
And do you use extra pillows nowadays while
Yeah,
sleeping?
yeah, yeah. Really, I increase my
And
pillow. Yes.
do you wake up in the nights to feeling short of breath?
Yes, doctor. Recently, yes, I'm awaking at night because I feel shortness of breath. Yes, many times I'm waking.
Right. Do you feel any racing of your heart?
Sometimes, doctor, I feel racing in my heart. Yes.
Right. So, Mr. George, uh, are you getting paler day by day?
Doctor?
Paler,
No,
pale.
no,
And right. So, do you have any other medical condition I should know about?
no, doctor.
Any yellowing of your eyes?
No,
Any difficulty in swallowing?
no,
Any joint pains?
no,
Any problem with your water works?
no.
Any problem with your bowels?
My pulse okay, doctor.
Any weakness in arms or legs?
No weakness.
And Any rash on your body?
No,
Right. And any lumps and bumps?
no.
Mr. George, any disease that runs in the family, especially any heart problems?
Disease in my family. Only my father, doctor, he's died at 60 years because he was having lung cancer.
Right. And are you allergic to anything?
Yeah? What?
Are you allergic to anything?
No, no,
Allergic?
no, no. I have no allergy.
Are you taking any medicines?
No, nowadays, no, not taking.
Any over-the-counter medicines?
No, doctor.
Have you ever been hospitalized?
No,
Any surgeries
no,
being done in the
no,
past?
no.
And do you have a family, Mr. George?
Actually, doctor, I was living with my wife, but actually she left me since more than 2 years. I'm living now alone.
Hmm. And how are you coping with your life? I mean, living alone, any problems living alone? Are you
No,
able to
doctor,
manage
but
your life?
really, because I'm living alone, I went to work my job, and then I'm going home and cook food and sitting home.
Hmm. And do you smoke?
Yeah, I'm smoking.
And do you take any alcohol?
Actually, doctor, yes, I'm drinking.
Since how long you're smoking, Mr. George?
I cannot remember, but since long time, doctor, I'm smoking. I remember I was smoking since 16, 17 years. Yes.
And how many cigarettes you smoke per day?
About 20 cigarettes, doctor.
And have you ever thought of quitting smoking?
Doctor, I tried before, but really I failed, and I would not to stop smoking now. I feel it's my maybe sometimes may rest me, feeling rest after take smoke.
Well, Mr. George, in fact, Julius to health. So if you like, we can refer you to your physician clinic. They can help you in this regard.
Thank you, doctor. I appreciate it.
And how much alcohol do you take, Mr. George?
Actually, doctor, I'm drinking a large amount really because I feel sad, so I'm drinking
Hmm.
more amount alcohol.
Well, it will be also wise to cut down your alcohol because it can put an extra toll on your health.
Yeah, I will try it,
And we are
doctor.
here to help you out in this regard.
I will try, doctor. Thank you.
What do you do for a living, Mr. George?
I'm working as cooker sister, doctor.
Sorry, cook, right?
Cook.
And how are you managing your job? I understand it must be quite difficult nowadays
Yeah,
to
doctor,
manage all this.
really, really. As I told you, that is, difficulties only coming with effort or like this. So I find
Hmm.
some difficulties in my job, but this is not stop me to go job.
You are able to manage your job with this problem
Yes,
nowadays.
I can, but with difficulties, doctor. Really, I find
Hmm.
difficulties. Yes.
Well, if you like, we can help you in this regard, and we can contact your occupational health department. They can put you in a less exertion job.
Ready, ready, doctor. Thank you very much. Thank you very much.
So, Mr. George, so far we discussed that you have shortness of breath from the last few months, and
Yeah.
you mostly get it when you do some exertion, and when you take rest, it becomes okay.
Yes.
And it is getting worse day by day, and you are now using extra pillows to sleep, and there is some swelling around your ankles,
Yes.
and you sometimes feel the racing of the heart.
Yeah.
And you told me that you smoked 20 cigarettes from the last so many years, and you also take alcohol, and you are having difficulty in managing your job.
Yeah. Yes, doctor.
In this regard. So, do I miss anything important, or you want to add anything else in this job?
Doctor, also I'm feeling pins and needle sensation in my legs and on my hands.
Since how long, Mr. Job? I'm sorry I missed this very important information.
Yeah,
But since how long you're feeling this?
actually, I feel it since about 1 year, and it increased really. Nowadays, it's become more. Sometimes affect my sleep also.
Mr. Jose, have you ever checked your blood sugar levels?
Yes, doctor, I check it because my friend have this is machine to check blood sugar. I check it. It's good. It's okay.
Right. Do you feel any weakness in your arms or legs?
No weakness. Only this is sensation.
And any difficulty in walking?
No, but only because it's shortness of breath, so I have difficulties to walk.
Right. Uh, so, Mr. George, may I know, do you have any concerns for me?
Doctor, actually, what I can have because this is I really I have difficulties to manage myself with this shortness of breath. So how can I manage it and what I have exactly?
Well, Mr. George, after listening to your complaints, but I need to examine you,
Yeah.
and I may need to do some, may need to run some tests, blood tests, and maybe some X-rays of your chest.
Yes.
But so far, what I got from your complaints that most likely you are having a heart problem, and your heart is not pumping well enough. And when you do some exertion, you feel short of breath due to this reason. And also, there is certain fluid accumulating around your ankles. So, what we need to do is that we need to form a team of the doctors,
Yes.
including the physician and the heart specialist. And we may need to do some tests, including the scan of your heart
Yes.
and certain blood tests. And meanwhile, I would like to tell you that it will be wiser to stop smoking and to cut down alcohol.
I will
And
try,
we
doctor.
may give
Really, I will
you,
try.
and we will give you certain medicines
2 minutes.
which will strengthen your heart, and which we will give you some water pills, which will help reducing the amount of what fluid in your body, and you will feel better.
So it's not lung cancer like my father, doctor?
Well, Mr. George, since you didn't tell me any cough and any lumps and bumps,
Yes.
though there are other symptoms of the lung cancer, but by the way, you have any weight loss?
No, my weight, I feel it increased, not lost.
Yeah. So
Yeah.
most likely, you don't have any lung cancer
Yes.
like your father.
Yeah, I hope, doctor. Thank you. Thank you for the assurance. Thank you.
Thank you, Mr. George. Do you have any other concerns for me,
No,
Mr.
no,
George?
no, doctor. Thank you.
Thank you, Mr. George. Thank
Thank
you
you.
very much.
So you have also 1 minute. Okay, خلاص, we finish, but you
Yeah,
have 1 minute, and because you don't do a full systemic review, you forget some points. Okay, Doctor Dr. Tanzil, I think. Yes, yes.
Tanzil Bukhari. Yeah.
Yeah, Tanzil. So we have now questions. First questions, what's your diagnosis in this patient?
Well, my most likely diagnosis is this patient is developing some heart failure, secondary to ischemic heart disease, secondary to smoking.
Heart failure, yes. What's differential diagnosis يعني for heart failure in this man? What can be
Maybe he is a chronic smoker, so might be ischemic heart disease.
one of the causes of heart failure? The other causes?
Excessive alcohol, alcoholic
Yeah,
cardiomyopathy.
yes, you are right. What's that? What's usually alcohol? What cause usually?
Cardiomyopathy, I think dilated cardiomyopathy.
Which
Most
type?
likely in this case,
Which type of cardiomyopathy can cause alcohol? Dilated.
dilated.
Yes, you are right.
Yeah.
Dilated cardiomyopathy. Okay.
I will put the dilated cardiomyopathy on the top because this patient also having numbness and tingling in the arms and legs.
Okay. طب why don't take more detailed history about alcohol? He told you
Yeah, I should
I'm
do the case
drinking.
questionnaire.
Yeah, you are
Yeah,
right.
yeah, yeah.
And also you should ask him before about amount of alcohol consumptions. He will tell
Yeah,
you,
yeah,
yeah,
yeah, yeah,
he
yeah.
will tell you that I'm taking, if you ask, he will tell you that I'm taking 20 units daily and also in weekend other 20 units since long time. And here you should ask about cage questions. If you ask these questions and he tell you that my wife left me, if you ask him also more, he will tell you, yes, she left me because I'm cannot stop drink alcohol.
Yes.
Also, other issue, what's drug can cause cardiac myopathy?
This
If patient alcohol,
chemotherapeutic.
I mean, if patient alcoholism, so can be also take other medication that can cause cardiomyopathy, like amphetamine, like cocaine.
Amphetamine.
Yeah. So also in this patient, you should ask about drug abuser. If you ask him, he will tell you, yes, I'm taking amphetamine. So you forget to ask about illicit drug. This is very important. In patients, alcohol.
Amphetamine and cocaine.
Yeah,
Okay.
and you should ask about recreational medications, recreational drugs. Maybe this patient has taking this medication. What other causes of
Right.
also cardiomyopathy in young patient, 40 years?
Parasitic infestations
What
like
this?
the thing. Really, I don't remember, doctor. Really, I'm
Hyperthyroidism and thyrotoxicosis also can cause
hypothyroidism.
hyperthyroidism can cause also cardiomyopathy. So you should ask
Okay,
about
okay.
thyroid symptoms and also pheochromocytoma. Also pheochromocytoma can also cause symptoms of or can cause cardiomyopathy as we know.
Right,
How
right.
can do investigate this patient? What you will do for him?
We need to do the complete blood count
Yes.
to see anemia,
Yeah, you are right.
and we need to do the BNP,
PMP, yes, you are
and
right.
we need to check the echo. We need to do the echocardiography, and we can do this liver function test
Yes.
and this GGT, gamma glutamate transferase,
Yes.
and we can also do the vitamin B12 levels in this
Yeah.
case.
Yes, you are right. You suspect that this patient has vitamin B12 deficiency due to chronic alcoholism.
Yes.
Yeah. And also alcohol itself, as you know, it can cause sensory or motor or sometimes mixed polyneuropathy.
Yeah.
So also need to do also thyroid function test in this patient. It's very important for this man to do this. Okay. How can manage this patient? What management you will do?
Well, management needs the education and counseling of the patient, and we should refer him to the alcohol and cigarette cessation clinics.
Yes.
And if he needs any social support and financial support, we can offer him. And
Yes.
we need to form a multidisciplinary team, including his GP, general and physicians, and heart specialist.
Yes.
Uh, and we need to give him like diuretics,
Yes.
um, beta blockers,
Yes.
and maybe we can add B12 supplements.
Yeah. You mentioned that he will involve multidisciplinary team, including his GP and what else? Who's else?
Physician, general, internal medicine,
He need cardiologist also or no?
cardiologist. Yeah, cardiologist. I told cardiologist and heart specialist,
Yeah.
cardiologist.
And
Yeah.
occupational health worker he need. Yes, because
Okay.
these
Yes.
symptoms affect his job also. So
Right.
also, when you will start beta blockers for this patient?
Well, I'm not sure. I'm not sure really. There is some limitation to start in.
Is there any indication for beta blockers in this patient?
Well, I'm not sure, doctor. Really, I'm sorry.
طب this is it's reversible or irreversible heart problem? The patient's taking alcohol. It's reversible if he stop drinking or not reversible?
Really, I'm also not sure. I think
Yeah.
it's reversible. I think most likely.
Yeah, if it's pick up at early stages, so and the patient stop alcohol, so this can be reversible. But really, if it's cause severe injury of the heart muscle, so can be irreversible. And this patient,
Okay.
yeah, this patient need to start beta blockers for him also. Okay.
Immediately.
Usually in the acute stages, if the patient has acute stage, we can delay the beta blockers after start ACE inhibitors as we know that the guidelines suggest that the patient with stable heart failure should initially to be started on ACE inhibitors and then followed by initiation of beta blockers therapy.
So we will give him ACE inhibitors and diuretics.
Yeah.
Then we will give beta blockers.
Yeah, you are right. You are right. So this case of shortness of breath, it's common. Really, it's common in examination. Always come either in station 2 or in station 5 in this old format. And next year will become in one format. So will be examination and history taking together in one station. Shortness of breath common. So first of all, we should do complete analysis of the symptoms of shortness of breath. So as you mentioned, Dr. Tanzil, onset when it starts, and also duration. And very nice to ask about how's his breathing before to develop the symptoms. He mentioned to you that everything was okay before. And also we should ask the patient if does the symptoms come suddenly or gradually, and you should ask him about the course of disease if the symptoms persistence or on and off mean intermittent. And if it's intermittent, you should ask him how frequently he experiences this breathlessness. And then for any breathlessness, you should ask about what the precipitating factors usually can be with exertion or sometimes can be when the patient lying flat. So we should ask both questions because this can differentiate between pulmonary causes and sometimes cardiac causes or the other causes of shortness of breath. And then we can ask the patient about relieving factors, what the factors that can improve the patient. Usually most of patients with the cardiac cause will improve when take rest. And also medication, sometimes you can ask the patient, maybe the patient has improved inhalers and he feel better, or maybe sometimes use sublingual nitrates. Then you should ask about time. Time, it is very important because as we know, some disease can cause shortness of breath at the end of the day, like some patient with myasthenia gravis. Or the patient, like patient with heart failure, can awake at night because shortness of breath, especially if they have left ventricular dysfunction. So they can awake at night because shortness of breath. Associated symptoms, very important to ask about chest pain. Because why chest pain? What's the importance of chest pain? This can give clues if the patient has ischemic heart disease. Maybe the patient has a recurrent attack of ischemic heart disease, and as we know that this is the main cause of heart failure in a patient has high risk factors for ischemia. Or maybe the patient has before myocardial infarction and this is the cause of heart failure. 1 minute, please.
بدنا يصير لما يصير حظر تجول.
Yeah. So the other thing, we should ask patient if he has palpitation. Why palpitation? Dr. Tanzil, you can unmute yourself, please. Palpitation, because palpitation, maybe the patient has مثلا Hockham disease, maybe the patient has disease can affect the heart electricity, so this is also can cause heart failure. Very important to ask about symptoms of presyncope or syncope. You forget to ask about this, Dr. Tanzil. Why? Because this can give you clue about the patient if he has arrhythmia. So, or if he has underlying left ventricular outflow obstruction, like patient have aortic stenosis or Hockham. So this patient can have manifestations of presyncope or syncope while do exercise or walking fast. As we mentioned, orthopnea indicate left ventricular dysfunction, very important. Then we should ask about edema, very important, as you ask me, and this will give a clue that this is most likely due to heart problem. And then we should ask about full respiratory symptoms. You should not forget anyone. You should ask about cough up blood, sputum, wheezing, because this is, as we know, that there is also broad differential diagnosis of lung disease that can cause shortness of breath. And also we know that many disease, lung disease can also lead to the cor pulmonale. So can lead to the symptoms that your patient have. Maybe this patient has fibrosis, so this can cause to cor pulmonale. Maybe the patient has but he's young. COPD can also lead to the core pulmonale. Then thyroid disease, either hyperthyroidism and hypothyroidism. Both can cause also shortness of breath. As we mentioned, hyperthyroidism, its main cause also is one cause of cardiomyopathy. So we should ask about thyroid symptoms. You should ask about vasculitic symptoms. If the patient has fever, joint pain, rash, very important. This is you ask me all these questions because maybe this is patient have any vasculitis. Maybe this patient have SLE and SLE cause to cardiomyopathy also. And very important to ask about renal disease. I think you don't ask me about the urine output from the urine because maybe the patient has nephrosis or have a chronic kidney disease. All this disease can cause also to shortness of breath.
Yeah, but I asked you about this generalized question. Any problem with your waterworks?
Yeah, you
so
are
I
right.
should ask specifically.
Yeah, you should ask me about amount because if I told you, doctor, I don't pass more urine, so maybe this clue for you and the frothing of urine.
Okay.
طبعا about best medical history, it's not enough to ask me, doctor, you have you ask me only what if you have any previous medical illness. No, it's not enough. I will mute Doctor. All mute. You can unmute yourself, Doctor. Tanzil, you can unmute yourself.
Yes, I'm here. Yes.
Yeah. So you should ask, as we mentioned, about. You should ask patients specifically. Do you have any cardiac disease? Do you have any lung disease? Because maybe the patient have something, but cannot. He will not tell you sometimes if you don't ask me specifically about this. You can ask him if you have any gland disease. You should ask him patient in this specifically. And also for family disease also. You should ask in more details, and you should ask not only anybody, ask more any disease, because maybe the patient has a disease running in the family. How come? If you don't ask him about this, he will not tell you. If you ask him only family disease, any one of us, if ask me what family disease I have, maybe I remember my father, my mother only. But if you tell me any disease in the other family member running in the family, maybe I remember my brother, my sister, the others people. Medication, very important to ask any medication, any over-the-counter medication and illicit drug. Medication here, very important to ask about appetite suppressor. Why?
Because they can cause pulmonary hypertension.
Yeah, phenylphloramine can cause pulmonary hypertension, especially in obese female. This is very important. Social, very important about alcohol consumption, really very important. Any station you should ask about alcohol. And not only do you drink or not drink, also amount of alcohol. Because maybe the patient is taking large amount of alcohol. And if the patient take more than 14 units per day, so this is, 14 units per week. So here you should ask about gauge
questionnaire.
What is gauge questionnaire? We can repeat it now, me and you. What questions?
Do you ever feel to cut down your alcohol intake?
Yes.
Or do you feel annoyed by the questioning of the people?
Yes.
And do you feel guilty? And do you ever take alcohol as an eye opener in the early morning?
Yeah, very nice. So this is very important. If you feel that these patients take a large amount of alcohol, it's important to ask about this questionnaire because can give you that it's his alcoholism.
Sure.
Yeah. And very important if the patient is female to ask about full female history because as we know the important cause of cardiomyopathy, postpartum cardiomyopathy. And this is come in before in PACES exam. Really, it come many times that the patient has postpartum cardiomyopathy. So it's very easy. Only after you complete the questions, you ask patients about full pregnancy. Here, very important. Really, always. Any station 2, any station history station. Very important to ask about full systemic review. And I advise you to consider anemia like systemic review. يعني you should ask about symptoms of anemia together. Always, because sometimes we forget to ask about all symptoms of anemia. We ask, yes, you have shortness of breath, yes, you feel dizzy, yes, but sometimes we cannot put these symptoms together that this is symptoms of anemia. So please ask all about symptoms of anemia together, and consider its system and ask about it. And also, we should ask about thyroid symptoms. We should consider always thyroid disease in any station 2, because station 2 sometimes if you don't remember to ask about something, you will miss important thing, like in your history. When you don't concentrate about alcohol, you miss this. When you don't complete neurological symptoms, you miss to this is patient has also symptoms of neuropathy, like this. And for female history, it's very important always to take female history from any lady. You should ask her about her period, is it regular or irregular, about the amount of periods, amount of blood, it's heavy or normal. You should ask about when was last time get pregnant, and because maybe when you ask her, this will give you many clues. Postpartum cardiomyopathy, postpartum thyroiditis. This disease, it's common in PACES exam. And also, you should ask about oral contraceptive pill in female always, because many diseases related to oral contraceptive pill. So nowadays in PACES examination, really they concentrate about medication. Many times they concentrate about medication. You feel in station 2. Many times, and inshallah we'll discuss next time also one disease, also the clues in the medication. So if you forget to ask about medication in details, maybe miss something important. And also illicit drug. If you forget to ask this 40 years patient, you should ask him about illicit drug. This is everything about taking of history. Now, last thing I will tell you. So, differential diagnosis of progressive shortness of breath, always we should put in our mind, pulmonary causes, COPD, pulmonary fibrosis, sarcoidosis, tuberculosis. You don't ask me about travel history. Travel history is also important. Cancer, pneumocystic cardiac. You don't ask me about HIV risk. Maybe this patient has HIV and now this is symptoms of pneumocystic cardiac. The cardiac causes, as we mentioned, cardiomyopathy can be caused by ischemic heart disease, can be caused by amphetamine toxicity, can be caused by hyperthyroidism, pheochromocytoma, alcohol, postpartum. Also, the other cause of shortness of breath, anemia. For any causes, anemia and renal failure. And don't forget pulmonary hypertension, drug-induced or primary pulmonary hypertension. This is first case for today. Please, if anybody have questions, I can answer him.
Thank you very much, doctor. Thank you very much.
Thank you, Dr. Tanzil. Thank you very much.
I have only
yes, Dr. Tanzil.
one question here.
Yes.
That so when in the end when we will say that you have this shortness of breath due to the heart problem.
Yeah.
So he is we will tell him that this is due to alcohol or this is due to
because you don't find in this patient, if you ask him, you do full analysis of the symptoms, you will not find anything else. This patient has no, if you ask him, he has no hypertension, no diabetic, only smoking risk factor, and his age is 40 only, no family history other than lung cancer. So this patient has no risk for ischemic heart disease. And if you ask him about thyroid symptoms, no signs of thyroid toxicosis. If you ask him about pheochromocytoma, you will not find anything. You will find only alcohol and amphetamine. And he has other clue. He has numbness, tingling sensation. So you have two clues. So he should tell the patient that most likely diagnosis that you have, it's alcoholic cardiomyopathy. And for this reason, we'll do some tests, including blood test and also heart scan, to confirm our diagnosis. And really the diagnosis of alcohol cardiomyopathy depends on a clinical history only. You cannot confirm diagnosis, but only you need heart biopsy to confirm. But really there is no one test to confirm diagnosis that is alcoholic cardiomyopathy. Only in echocardiogram we will find usually dilated will affect left ventricular, dilate left ventricular, and also you will depends on the history that patient take a large amount of alcohol.
And if the patient asks that is it reversible or irreversible,
Yeah.
so I can tell that, well, I'm not sure at the moment.
Yeah, you are right.
And
Because
the
yeah, you are right.
cardiologist will be better person to answer
Yeah,
you.
yeah. Because this depends on the time, really. If it's yani, the patient has symptoms early and they review the doctor and not drink since long time, so this can be reversible. But if the patient take since long time and he has, I read about this, they depends on the degree. If the patient about New York Association's heart disease, if the, first and second degree, this is can be reversible. But if the patient reach to third or fourth, this is can irreversible.
Right.
I read this in one website.
Thank you, doctor. Thank you very much.
Thank you. So now we'll go to the other case. There will be communication skill.
Yes.
Dr. Muhammad?
Muhammad, yes, Muhammad Hamza.
Yes, Dr. Muhammad. This communication skills, I will share the scenario in the chat and I will also read it. This is scenario come in this diet, 120 in India. I think it's Center Kochi or Kochi. I don't know the name well.
Cochin.
Yeah, this. You are senior house officer working in neurology department. 25-year-old man, Mr. Ahmed, developed weakness ascending, affect both upper and lower limbs 2 weeks after chest infection. Nerve conduction study and CSF study confirmed diagnosis of Guillain-Barré syndrome. Discuss, Mr. Ahmed, the diagnosis, prognosis, and management plan with IVIG. You have 3 minutes to prepare yourself.
Okay.
Doctor, we have a session 5 also? Session 5 or it is?
Wallahi, I will try, but because you know that we cannot go out home after 7 o'clock, so I need to finish at 6 o'clock. So if we finish at 6 o'clock, we'll do it. Yes.
Okay, thank you.
Doctor, I have one question, Dr. Hassan.
Please, Tfadal.
About the cardiomyopathy due to alcohol, is it, you said, irreversible or?
We mentioned before that this can be irreversible if picked up early, and the patient, according to New York Heart Association's classification, 1 and 2 can be reversible if the patient stop drinking completely. But if the patient has advanced disease, so this will be unfortunately irreversible.
Okay, thank you.
So our patient has advanced disease. Now he's with any effort has shortness of breath. So this can be irreversible. Yes, doctor, we can start?
Yes.
Are ready now, or you need some?
You will give me 1 minute?
Take
Just
your
1 minute.
Yeah, take a rest.
Okay, can I start?
Yes, Dr. Muhammad.
Hello,
Hello.
I'm Dr. Muhammad, one of the doctor in the nerve clinic. Am I speaking to Mr. Ahmed?
Yes, Doctor, I'm Ahmed.
Yes, Mr. Ahmed, nice to meet you.
Thank you, Doctor. Thank you.
Mr. Ahmed, we are here today to discuss some problem related to your health. Is that all right?
Yes, please, Doctor. I'm waiting you to tell me what I have. Please, Doctor.
Okay, Mr. Ahmed. Before proceeding into the details, can you tell me what's your job?
Doctor, really, I'm suffering this weakness in my limbs start 1 week before, and it increased day by day. On the first days, I was able to walk, but I feel difficulties when walk fast or running. But now I cannot walk at all, Doctor. I cannot move my legs. Also, my hand also become weak. Also, I cannot also do some fine movements. Doctor, I'm afraid because this can affect me, really, Doctor. I'm football player, and I have competition after weeks. So please, Doctor, please help me, please.
Okay. I appreciate your concern, Mr. Ahmed.
Yeah, really,
I
please.
will try to do my best to help you.
Thank you,
Uh,
Doctor. Thank you.
yeah, yeah. And Mr. Ahmed, they also our team they did for you some uh, some workup in form
Yeah,
of
yeah, they did this painful test. Yes, very painful. Yes, you are right.
Sorry for that. Sorry.
Yeah, yeah.
We are trying to do your best for you. You know, you will be beside you.
Yes.
We'll do everything to help you,
Thank you,
so as
Doctor.
you can recover soon to catch your your job.
Thank you.
Mr. Ahmed, anyone spoke to you about the results of this test
No,
you
no,
have done?
Doctor. I'm waiting you now. I'm waiting you to tell me because I tell this time that Doctor he will come and tell you everything.
Yes. Mr. Ahmed, actually the results are with me now,
Yeah, please, Doctor.
and unfortunately it's not as we hope.
Why, Doctor? Why not as you hope?
Uh, you have a problem. You have a condition called Guillain-Barré syndrome.
Guillain-Barré syndrome. What's this, Doctor?
Yeah. You didn't hear about that, am I right?
No, no, no.
Yeah. Do you want
Very
me to
sure.
explain for you?
1 minute, Doctor. I will mute.
Jibo,
I will mute.
coach.
Yes, please, Doctor Muhammad, unmute yourself. Doctor Muhammad, unmute yourself.
Yes, it is a medical term for medical condition
Yes.
in which there is inflammation, or we can say soreness of
Yes.
the layers which covering the nerve
Yes.
in your legs and your arms.
Yes.
Okay,
Yes.
and this soreness or inflammation cause some sort of damage to these layers, and it cause this weakness you have. Okay, you are
Yes.
following me?
Yes, Doctor. Yes.
Yeah, you can see here, if this is a nerve, there is
Yeah.
a layer. Yeah, in this layer, it helps this nerve to conduct electricity very fast. When this layer is affected, it can cause this weakness.
Oh, so, but what's the cause, Doctor? Why,
And
why, why I have this disease?
yes, I'll explain for you. But before explain more, this nerve also very important things. This also disease can affect also the muscle of the breathing and muscle of the swallowing. You get my point?
So
This is
what?
very important.
Yes, if it affect my breathing, so what will happen, Doctor?
This is why we want now.
Yes.
First of all, we need to keep you with us, okay, and to check for you we will do some blowing test to make sure that your breathing is okay, then
Yeah.
we will need to follow you closely.
Yeah.
Okay.
Yes.
Going back to your question, what might be the cause? This is we think it might be due to disturbance in your immune system, the defense system of your body. This is the system which fight the organism against the organisms.
Yeah.
But in situation, it destruct our own cells.
So, doctor,
You get my
this disease same multiple sclerosis, because my cousin also have this multiple sclerosis. So I am afraid to be like him. Please, he's in a wheelchair, doctor. My cousin, he's in a wheelchair. So it's MS, multiple sclerosis.
No. I want to assure you that this is not multiple sclerosis. Well, now we have a confirmed diagnosis that you have a condition called Guillain-Barré, and it's totally different. Okay.
So, doctor, you can do brain scan for me to know that it's not multiple sclerosis, please, doctor, because my cousin, I know he's suffering more and he's now on wheelchair. So now need to do this brain scan for me.
Yeah, I appreciate your feeling, Mr. Ahmed, but we are sure 100% that what you have is a condition called Guillain-Barré. It's not multiple sclerosis. Multiple sclerosis is a condition usually affect the central part of the nervous system. What you have a problem in the peripheral part in the peripheral nerves.
Okay.
So it's totally different.
Okay, thank you for the assurance, doctor. Thank you very much.
Yeah. The other things that I want to reassure you that we'll be with you, beside you, give you everything you need.
Yes.
I want to tell you that now, first of all, we'll keep you with us to follow up you regularly and to make sure that everything is okay, especially your breathing.
Yes.
And our team, with our consultant, they decided to give you what we call it immunoglobulin. Did you heard about this?
No. What this, doctor?
This is some sort of medicine. We give it intravenously through your blood channel.
Yeah.
Okay, and it helps very much in your condition. So as it speed your recovery very quick.
Yes. I hope, doctor. I hope.
Yeah, we'll give you this medicine.
Yeah.
Okay. And as I told you, we'll observe you very regularly. And another things I want to speak about also these medicines also. It's good. Every medicine has its benefits and side effects.
Yes, it's right. Yes, all right.
Yeah. So this medicine also has some sort of bad effects. Can cause sometimes some sort of allergy and things like this.
Yes, doctor. Yes.
Another thing I want to reassure you that this the Guillain-Barré, the condition you have, it has good prognosis. It's not like multiple sclerosis.
What do you mean, doctor? Prognosis?
Yeah. Sorry for this term. It has good outcome.
Yeah.
Most of the people, they recover completely and they go back to their work, their life without any problem.
So, doctor, when I come back because I'm playing football and I have competition after 2 weeks, so maybe if you give me this medication, I will be okay after 2 weeks?
I highly appreciate your concern, Mr. Ahmed, but I'm sorry to tell you it's not 2 weeks. We need more time than 2 weeks. It may be months. It may be months, and the duration is depends upon the response.
You will give me this medication for months, doctor?
No, we'll give you. I mean the recovery. It will take months.
Yeah,
But
yeah.
these medicines will give it for short period, days only.
So
Okay.
after this period, what I will do? Why I will not come back normal? What you will do for me?
Most of the people they recovered completely and go back there to their life.
Yes.
A small number, very few numbers. They might have some sort of permanent weakness.
So it will be wheelchair bound, doctor?
I want to reassure you that this is it's a partial weakness, not a complete one. And not all the people. Most of the people they are recovered.
I hope
For example,
I hope to be one of them, doctor.
yeah, we hope so.
Thank you, thank you.
Another thing, some people they are not responding, but this is very, very, very rare.
Yes.
Some people they are not responding, and they will have permanent
Yes.
weakness.
Okay, doctor.
Did you get my? I'm giving you a lot of information. I know, but are you following me?
You have 2 minutes, doctor. Yes, doctor, I am following you.
What's your job, by the way? You are
As I told you, I'm working as football player.
Okay. Are you a smoker? Do you smoke?
Yes, doctor, I'm smoking. Yes, but only
It's better.
2-3 cigarettes per day, not more.
Can I know what's your concern now, Mr. Ahmed?
Doctor, can I take this medication at home? If you feel I'm okay, you can discharge me home and taking this medication at home.
Yes, I highly appreciate your concern. I'm sorry to tell you that no, this medicine should be in the hospital because we are giving it through a channel, so we need to observe you.
Yeah.
And most important, rather than the medicine, we should observe your progression. We don't want you to go to
Yeah.
breathing
So
problem.
when I will go home?
We'll follow you
Yes.
regularly, closely. Our team will reassess you every day.
Yes.
When we feel that you are okay, we are comfortable to send you home, we will send you.
Yes, thank you very much, doctor.
Okay. Do you have any other question for me?
No, doctor, no.
I'll give you my contact hospital number. If you have any question, you can call me.
Yes.
I'll give you some website leaflet to read about the condition Guillain-Barré.
Yes.
Is that okay?
Thank you very much, doctor.
Okay. Mr. Ahmed, can you just tell me what's the message you got from our discussion?
You told me, doctor, that I have this disease called Guillain-Barré and need to give me medication in hospital, and I will be okay after that, but this needs some time. And really, I thank you very much for your reassurance, doctor.
Okay. Thank you very much.
Okay, time off. Thank you very much, Dr. Muhammad. I think this first time you discussed Guillain-Barré disease with anybody, or you discussed it before?
No, it is first time.
طب you read about this before, about how can talk about Guillain-Barré in communication skills, or this first time you read?
No, I read before.
You read before. And for IVIG immunoglobulin, you read it about it before?
I don't remember really.
Because really many candidates didn't don't read about IVIG, and for this reason they brought, and we are using it many times in hospital, so they need for any candidate to know everything about IVIG. I will ask you some questions now. First questions, what legal issue in this scenario?
Legal issue. Legal issue. I don't know. I don't know if we need consent for IV immunoglobulin or not.
Consent, you need written consent?
Yeah, I don't think we need. Am I right?
IVIG like any medication. So verbal consent is enough for it. IVIG
Okay.
as medication, but you should tell the patient all side effects and take verbal consent for him. But this patient, he did lumbar puncture before, so I think he did consent for this. This is not important, but only maybe they ask you this question only, that need consent or no. So this, like any medication, so verbal consent is enough for this medication. So what the
Okay.
ethical issue in this scenario?
The ethical issue here is the autonomy.
Yes.
This is the right of the patient to know about his disease
Yes.
and to share in the plan of management.
Yes.
And he is right to refuse or to accept the plan of management.
Yeah. What else?
The other thing, beneficence,
Yes.
is to do good for this patient by admitting him, follow up his breathing, and to give him immunoglobulin. Malfeasance is not to do harm for him, and
Non-malfeasance, yes.
non-malfeasance. And autonomy, we have to treat him like other patients.
You mean justice,
We,
yes. Justice.
Yeah, justice, yes. Regardless of his religion, race, or
Yes.
yes.
طبعا from next year nobody will ask you about this issue, but you should apply it in your scenario. When you are talking, you should apply it, but nobody will ask you from next year about this, because communication skills, no questions after it from next year. Okay. So sometimes in questions, Dr. Muhammad, they ask you knowledge questions about disease itself.
Okay.
So this patient, and this question is asked this year, how long this patient need to be full recovery?
You mean time?
Yeah, how long time?
Take months is,
How
as I
long?
know, it will be
1 month,
up to
2
6
months?
months.
Yeah, you are right. Very, very, very good. Very good. Because this is important question and this is good answer. طب, can this patient have other attack of Guillain-Barré? And this can be symptoms repeated next time?
I'm not
Or
sure.
it's,
I'm not
yeah,
sure. Really,
yeah,
I
can,
don't
yes,
know.
Yes,
can.
because antibodies are already made.
Yes, you are right. Can sometimes the patient have other attack of Guillain-Barré, but if the patient has recurrent attack many times, so this is can be CIDP. Okay, but if usually the patient maybe have attack after 2 weeks of management, so this is, we call it other attack of Guillain-Barré. But if the patient has a recurrent attack over the time, so this is can be CIDP. CIDP, we have two types of CIDP. Can be relapsing remitting like MS, and also can be progressive disease. Thank you, Dr. Muhammad. I will clarify something. First of all, when you start to introduce yourself, you hello, you told that you are working in neurology clinic and you are in a neurology department, so you should be
Okay.
pay attention for this. It is very important.
Okay.
Second, confirm the patient identity. Second thing. Third thing, you can ask the patient here to reassure him that if he would anyone to be with him, because you are around to break bad news, so maybe the patient need anyone to support him. So here important, especially in you break bad news, it's better to ask the patient if he would anyone to attend with him.
Okay.
Yeah. Fourth one, you should take permission to talk about health condition. You should tell him, I'm here, we are here. You should clarify what's your agenda here. I am here to discuss your health condition and discuss your management plan. So it's okay for you. He will tell you, okay. Then you should ask patient, as you ask me, what do you know about your condition so far? The patient, he will tell you everything he know about his condition. Sometimes you need to ask him, what's your expectation, really? Because sometimes if the patient expects something, so this will make the scenario very easy. Maybe the patient tell you, doctor, I think I have multiple sclerosis. So in this time, you can tell him that no, you have other disease called like this. Maybe the patient tell you, I have cancer, and will reassure him that it's not cancer, this is other disease. Maybe will more easy for you also. After that, طبعا, as you mentioned, when you close your case, you should tell the patient, ask him first questions about his concern, and please repeat it many times, because sometimes the examiner, wallahi, I know one lady, she failed with the examination. The examiner told her, I didn't hear you ask him about his concern, because she asked only one time, and he didn't hear her. So ask patient many times, what's your concern? And please use word concern, not questionnaire, not question, not, okay? And for summarize, before to tell the patient recap, you should summarize, because maybe the patient need from you other things. So first summarize before to tell the patient to recap what he get from this conversation. And to offer help, here you told him, I will give you a hospital contact number. He is in hospital already, this patient. So first you should tell him that I will provide you websites, brochures, leaflets. And if the patient is in a clinic, so you can tell him, I will give you hospital contact number. But the patient now, you can tell her, if you have any question, please tell the nurse to call me and will come directly to discuss with you. About Guillain-Barré disease. Many of doctors or candidates really talk in more details about disease. Really, in the examination, they would not to explain more and more, like in our practice. Yeah, in our practice, if you now would to explain to anyone about Guillain-Barré, what you will tell you in our practice? That will tell you that this disease affects the nerves, okay, or the layers cover the nerves, like this. Not necessary to tell in more details. It's maybe one line enough to explain everything. Yeah, like I will tell you what I will tell the patient in this scenario. I will tell you that this disease affects the immune system that defends the body usually against the bug. And this affects the nerves of the limbs and body. And usually triggered by an infection. You should mention for this patient, when he asks you about the cause, this is most likely triggered by infection that you have 2 weeks before. After you tell the definition of the disease, you should tell the patient what the clinical manifestation. What the clinical manifestation of Guillain-Barré? This can cause weakness, affect the upper limbs and lower limbs, and can make difficulties to perform daily activities and walking and like this. And then you will tell the patient complication, and you should mention, or you should use the word serious. Hello? You hear me well?
Yes.
You should use the word serious complication.
Yes, we are following, yes.
Why word serious or life-threatening complication? Because to convince patient later on about the medication that you will give him. Yes? So I should hear this word from you, Dr. Muhammad. Yes, you should tell me that this disease can cause sometimes serious complication, life-threatening complication that affect the breath muscles, and maybe the patient need to connect to the breath machine. And also sometimes can affect the swallowing, make difficulty to swallowing, and the patient may need to need feeding by tube. So, and sometimes you don't mention for this, and then sometimes this disease can affect the heartbeat, cause slow heartbeat or fast heartbeat. Sometimes can affect the blood pressure. You should mention this. You don't mention for me, only you mention for breathing. No, there's other thing. Complication. But you should here mention, now give the patient reassurance. And now you tell him that it's serious disease, it's life-threatening disease, but now give him reassurance. But with appropriate treatment and monitoring, most people will make a full recovery. So when you explain the disease definition, then tell the patient what manifestation of the disease, then tell the patient what the complication, serious complication, but then reassure him, tell him that with appropriate treatment, most people will make full recovery. Here, the patient will know that this disease is serious, but in the same time will know that there's something can be done for him. Then you can explain for medication. What medication? IVIG, what medication? You should explain in more details. Usually, immunoglobulin, you can tell him that this blood proteins that usually help your body for fight infection that have been prepared from a blood of healthy people. Its mechanism in the disease is not known well, but can help to block the protein that attack your nerves. Finish. Now, you should tell him, because why he asked you if he can take the medication at home, because you don't tell him that this medication given by blood channel. You should tell him that this medication given by blood channel with slow infusion and will keep you under close monitoring. What's its side effects? You are right. You tell me very nice phrase. You tell me that this medication can cause side effects, but in the balance of the side effects and complication of disease, we find that the benefit will overweight the complication. Very nice. You should tell the patient side effects of immunoglobulin. Usually there is common side effects can occur with any patient, really. We apply it many times in hospitals and we know the complication common, very common. 90% of patients will have this complication, like headache. Many patients have headache, back pain. So you should tell him that many patients with this medication maybe has headache or pain in their back, or sometimes raised body temperature and feeling fatigue or feeling tiredness, like flu-like symptoms. And for these symptoms, this is not serious symptoms. You can only slow the infusion rate of the medication. But also we can tell you that sometimes it's rare to this medication to cause sometimes serious side effects, and tell him that it's rare to occur. These symptoms, it's rare to occur, and will be ready if any symptoms occur with you. Like allergy, tell him that many patients have allergy for this medication, and so for this reason we'll prepare some medication that can give at time, and we'll start with slow infusion to see if you can tolerate it. Allergy, most important complication you should mention for patient, and tell him that it's easy to be managed. And also this other side effects, and important to mention the patient, especially old patient, or the patient has other disease like heart disease or ischemic stroke, that this medication can cause formation of a blood clot. And here, reassure him that it's rarely in healthy people who has no previous disease, and this can cause heart attack or stroke. So you tell the complication and reassure the patient that it's rare to occur in healthy people, and if it occurs, we'll stop infusion directly and we'll manage the problem directly. And the third side effects important. So 3 serious side effects important: allergy, formation of blood clots, and non-infectious meningitis. So tell him that sometimes this disease can cause inflammation or scarring in the brain membranes or in the lining of your brain. And tell him that it's reversible. This is usually reversible, and this can cause headache, raised body temperature, feeling sick, getting sick. This is everything. And then give him precautions about this medication. Tell him that if you feel any severe headache, if you feel raised body temperature, if you feel shortness of breath, if you feel dizzy, please tell the sister directly to inform me. You forget 2 points, Dr. Muhammad, and these important points. Physiotherapy. You don't mention physiotherapy. Even in the scenario, not mention physiotherapy, but you should tell the patient, because this is one of multidisciplinary team will involve in this patient. Physiotherapist, this patient needs physiotherapy. So you should tell him, because he asked you, the patient asked you, what else after this medication, how can improve after medication? You tell him that will involve also physiotherapist to do physiotherapy for you here in hospital, and when you will go home also will arrange you a course of physiotherapy to be better, and they will learn you some exercise can be performed in the home, and then we can teach your family how can do this exercise at home. And also you can mention that about blood thinning to avoid blood clots in your legs and lung. If the patient tell you when I will recover, outlook, not outcome, outlook, prognosis in non-jargon language mean outlook, not outcome. Outcome, this other issue. Outlook, this is the prognosis. So you can tell him simply this, because really Guillain-Barré has good prognosis in most of the patients. You are right. So tell him that most patients will recover completely over 6 to 12 months. Okay? But tell him few people, because now reassure him, but also you should tell him that some people also maybe not improve. So tell him that, and few people with Guillain-Barré will be left with some degree of permanent problem, such as some weakness, muscle wasting, difficulty to walking or pain. So reassure him that most people will recover completely, but over the time, give him maybe 6 months, 12 months, usually this patient, but unfortunately some people will left some degree of permanent problems. This is everything about Guillain-Barré and IVIG. I hope to be everything understandable for you. Any
Yeah,
question?
very, very clear, very clear. Thank you very much.
Thank
for
you, thank you,
this,
Doctor.
thank you.
So I mean, don't spend your time, Dr. Muhammad, in explaining more details about the disease. Yeah, like in our practice, when you tell patient you have thyroid disease, hyperthyroidism, what you will tell him? 2 words only. You have overactive of your gland. No need to do everything in details. And also here, you have disease affect the nerves and the nerves that supply electrical signals to the muscles. So for this reason, you feel this weakness. Because you have more tasks here, you have 2 tasks. You should explain everything, and the patient will tell you many concerns. Any other question, please? Actually, I would to complete with you today station 5, but unfortunately I should go because I'm outside and here not allowed to us to go outside after 7 o'clock. So I have no time to go. So inshallah I will meet you on Thursday at 4:30. Thursday, and I will try Friday also. So I will send the Thursday the link for you. Thank you very much.
Thank you.
Goodbye.
Thank you very much. Thank you.
Thank you, Doctor. Thank you.